we good?
Yep.
Hi everybody, my name's Jackie. I am a nurse navigator here at the Ivy Brain Tumor Center at Barrow Neurological Institute in Phoenix, Arizona. And I am taking over the Ivy's Instagram page to go live with our very first Brain Tumor Talks. So Brain Tumor Talks is something new that we're doing, and we're going to start doing this monthly. And what we're going to do is we're going to come onto Instagram and we're going to talk about different brain tumor topics with different members of our team. Oops. Trying to get let me fix my angle here. There we go. All right. Today we're going to be covering brain tumor patients and caregiver support with Lynette Verez, founder and president of Gray Matters Foundation. Lynette and I facilitate the Barrow Brain Tumor Support Group here, and basically this is a group that helps survivors and their caregivers navigate life after a brain tumor diagnosis. Now, during this live, we're going to cover common themes that come up in our support group, and also questions that we received from people prior to this, and also that we take during our live event as well. So if you're not familiar with the Ivy Brain Tumor Center, let me tell you a little bit about us. We are the largest Phase 0 clinical trials program in the world. Now, we are also the first of its kind in neuro-oncology. Now, what makes us different is that we get results on whether or not a drug is going to work for a patient in, on average, about 10 days. So we don't lose valuable time when we don't have time to lose. So we use personalized medicine to match the genetics of a person's tumor to new combo drug therapy. Now, we're trialing drugs that have never been tested in brain tumor patients before. An early success story for us is a patient with an aggressive meningioma who was trialed on a drug that's used for breast cancer, and so far this has been successful in keeping his tumor at bay. So if you want to learn more about our Phase 0 clinical trials and also more about this patient's story, please visit us on the Ivy Brain Tumor Center webpage. Now, my role here at Ivy is a nurse navigator, so I help basically guide brain tumor patients through their journey from diagnosis all the way through to survivorship. And I help plan educational events and help bring information like this to people out there who might benefit from it. So I'm going to go ahead and add in Lynette, and she's going to give you a little bit of background on how she got started with her foundation. I am new to technology, so bear with me here. And we should be here shortly. And here she comes. Hi, Lynette.
Hi.
How are you doing?
I'm great. How are you, Jackie?
I'm doing good, thank you. So thank you for joining us today for this very first live brain tumor talk. So why don't you get us started a little bit with some information on your background and how your foundation got started?
Okay. Well, I'm 22 years out with brain cancer myself, and I was diagnosed in 1998. And after having surgery and leaving the hospital feeling like there was no support, I started Gray Matters shortly after that. So I felt like if you need support, you give support. And things sort of evolved from there, and now I help your hospital with the support group. But Gray Matters, I help families all across the world by sharing support, not statistics.
Well, great. Well, thank you for being here, and let's just kind of get right into it. For those of you who may be wondering, my stand is having some gravity issues, so we're trying to work that out as we go here. But so basically how we're going to do this is, like I said, we have questions that we've kind of compiled from common things that have come up in support group, also questions that were submitted prior to this, and feel free to submit your questions as we're talking, and we'll be happy to try and answer them as we go. So Lynette has a series of questions and I have a series of questions. But first I wanted to kind of just touch base on our support group. And Lynette, do you want to tell them a little bit about how our support group works?
Sure. So typically we would meet on the fourth Tuesday of the month in person, but because of COVID, we've moved that online. And twice a month we meet, and you can find those details out online. But we have two groups, both caregiver and patient, and we keep those separate so each both the patient and the caregiver have an opportunity to share their concerns and questions individually. individually.
All right, so let's dive in here. I'm going to have you go ahead and start with your first question, Lynette.
Okay, a person asked when they're newly diagnosed and they're not sure where to turn for support, where would they go? So you want to answer, or you want me to go ahead?
So, and I'll tell you, when I first meet people and they're starting on this journey, one of the things that I do talk to them about, because people look for support at different points in their journey, and everybody's a little bit different. So, you know, there's lots of different ways to find support. And so what I tell people is to utilize their friends, their family. Like I said, support groups aren't for everybody. So, you know, if you are interested in something like that, sometimes I find it very beneficial to meet other people who have gone through similar treatments, similar surgeries, and things like that. And that can be helpful. Community events, you know, people find support in different ways. There's always community events that are going on throughout the year. Lynette has some herself, but also from different organizations. When you go out to these events, you see other people, you see the survivors, you see the families, and you get to meet them and you make connections. And I think those are great ways to find support as well.
I agree. Definitely. A lot of times people meet one another in the hospitals during treatment, at least a group. That's what they've shared. And they're like, we never knew there was a support group. And personally, as a patient, it was attending a conference that it was eye-opening, you know, finding it, going, oh, there are other people. So for me, it was the support group. And once you meet somebody, then it's like it all falls in place. You hear about this, you know, hear about that. So you're right. And it kind of seems to fit in with who you are and which direction you want to take.
So when people first get diagnosed, they meet a lot of different doctors, they get a lot of different information thrown at them. What would be some organizational techniques or tips that you would have for people, Lynette?
So say that last part again.
Organizational tips or tricks.
Yes. I would suggest, well, first of all, if I meet them before they have surgery, because people are referred to me all the time after knowing my story. Gray Matters actually has a notebook that we have business card holders in, but now you guys have it. So if I have those on hand, I get those into the hands of the patient, because I explain to them, you're going to start receiving cards from business cards from almost everybody that comes into your room. And I also tell them, while they're waiting for their loved one to have surgery, write those questions down. My exact verbiage is, you're going to have about 3 minutes. When that person comes out, have these questions and write it twice. Write it, one to hand the doctor and one you. So then you're getting your mission accomplished. Your answers may not be completely, but paper, pen, and write those questions down and keep that 3-ring binder. And not just for the beginning, ongoing. So you can grab your records, keep it, because you may have an opportunity for a second opinion somewhere along the way, or attend an event where there's a doctor that you can ask. If you have those at hand, then you're prepared.
Great answer. One thing that I will throw in there on the caregiver side is that not so much organizational, but something to help with tasks that we have in our everyday life, is that when you go through something like this, people are going to come out of the woodwork and they're going to want to help. They're going to ask you, what can I do to help? And a lot of times people don't know what to tell them that they need. And I tell people, make a list, make a chore list, whether it be laundry, grocery shopping, get in the mail, whatever the case is. Whoever you can designate those tasks to and chores that you feel comfortable with, definitely utilize them while you can, because it will help lighten the load a little bit.
You know, that's perfect, Jackie. It reminded me, we have a brain buddy in our group, and had been a long-term survivor, all of a sudden found herself being re-diagnosed. And everybody's, what can I do? And something as simple as the wife is busy with the husband and she needs somebody to roll the trash out. And Stu doesn't want to ask anybody to do it. And all of a sudden 2 weeks gone by and the trash hasn't been rolled out. So again, you're right. Make that list and you'll find that the burdens of just the basic things are taken care of.
All right, next question.
How do you adjust to the new normal? And as I read that, having personally dealt with the new normal, There's no right or wrong way. And, one of the questions come up, you constantly get, but you look okay. The new normal is a personalized decision, and everybody's different. There may be different deficits. So from my perspective, I always tell people it's a personal loss, and you have to come to terms with that. But the new normal doesn't have to be a bad thing. Sometimes the new normal can be something that gives you a whole different opportunity. And yeah, that sounds cliche, but no, really it can be. And in groups, we talk about what are the things that if you had time to do, because that was me, if I had time to do, what would I do? Well, make that list. And it may not be tomorrow, it may be time, but the new normal doesn't have to be, oh my God, it's never going to be good again. So in group, we talk about that. And it may be church-based things. It may be family. You may have more time with your kids. Whatever that is for you personally, just start with the small steps and work towards something, towards the change until you're back to your normal or the new normal, if that makes sense.
It does make sense. So at least for me, it does. So my next question would be, how can someone know what is going on if they cannot be at the appointments? And I think right now this is very relevant because of COVID. People have not been able to visit their loved ones in the hospital. It's restricted to one visitor at a time. Typically, there's a whole family that's involved in the caregiving, and it's hard to communicate information. So one thing that I would tell people in this regard is one of the things that we utilize in the hospital is medical memory. So if you haven't heard of this, this is a device that you can use to record messages, and the hospital staff can record messages, and the doctors and even the patients can record messages and send them through a link to their loved ones. But this is a great way also too. We use it in the clinic visits to record the messages, and you have this video. You can share it with family members who want to kind of stay in the loop. And you can share it with anybody who you want to, but also you can rewatch it because nobody ever remembers everything that's said in those clinic appointments because it's a lot of information. So you can replay it and catch the things that you missed.
And it's
what else?
And it's that's the next thing versus recording it on your phone, right? I mean, it's not just here. We got this, from my understanding, is there's different, it protects the doctor and it protects the patient. So it's not passed around on the internet world or whatever.
Yeah. And sometimes recording those visits on your phone can be a little taboo and people aren't sure if it's okay or not. But I always tell people, just ask the doctor. A lot of times they'll be fine with you recording it, but just get that permission. That's kind of just a mutual respect thing. And a lot of times they'll just let you record it. The other thing that I would add in, again, on the caregiver side, is there's a web page also called Caringbridge. And what this is if you're in the hospital or there's a lot going on and you don't have time, a lot of times you're getting text messages and phone calls and everybody wants updates, and that can be very overwhelming. So this is a web page that you can add updates periodically whenever you want to. And again, you can give people access to this link, and they can come in and check in whenever they want to just to see if there's updates, but it kind of takes that off your plate of all those multiple phone calls and having to update people as well. So I'm going to remind people that too, is that if you guys have questions while we're going through this, feel free to submit them through Instagram, and we'll be happy to try and answer them as we go too.
That's a great idea with Caringbridge. I was just thinking the other day when a patient said, I'm so overwhelmed with all the text messages I'm getting. You can assign it to a family member, but Caringbridge is, because you can post comments anytime and they can respond, and you can be encouraged by that too.
Definitely.
My next question is, how do we stay healthy and keep stress levels low during all this, the new journey? Some of the things that we talk about in group and personally is keeping a good diet, exercising, even though that sounds like that's an impossible task. Something as basic as just walking, and it doesn't have to be miles. It can just be a couple houses down the street. Of course, your vitamins, taking your medicines like you're supposed to, doing meditation, maybe journaling, family time, whatever it gives you a clear head. No pun intended.
Yeah, definitely.
And that's both for the caregiver too.
Yes. Yes. And so some of the activities that sometimes, people can incorporate is just anything, if meditation is your thing, just kind of clearing your mind for a little while. There's things like task meditation, where you're doing like an activity such as like puzzles, things like that, or task meditation that will help. Journaling. I am a big believer in journaling, just kind of writing out those feelings and things like that. And what is your happy place? Visit your happy place. Is it family time? Whatever the case is. I think those are all great ways to keep the stress level low and stay healthy. Before we go to the next question, though, I did want to answer something for Franny. She asked, is there a way for doctors to use medical memory when they visit the patient bedside? So one, find out if the facility has medical memory, but yes, this is something that the physicians can use at bedside. In times of COVID and things like that, I know our hospital has utilized this to send messages just to keep family members updated, but our nurse practitioners were using it as well as the physicians. So that's definitely something that can happen if they have the capabilities available to them. So my next question is going to be, what side effects can be expected with a brain tumor patient? And I think this is a very complicated question because one, what we know with brain tumor patients is that side effects and symptoms that people experience are all based off of the location of the tumor. So they can be very different, even same diagnoses, but different location of tumors, your symptoms are going to be very different. So what I would say is this is always a good situation to discuss whatever symptoms that you're having with your medical professionals. So if you're going through recovery from surgery and you start to have trouble with certain things, make sure you're talking to the neurosurgeon staff about it. If we're a little further along and we're at a point where we're going through chemotherapy and radiation, sometimes these symptoms are just things that we need to manage while we're kind of going through these processes. So it's just really important to talk to those doctors because they're going to have tips and tricks for how do we manage nausea, how do we manage fatigue and things like that. What's normal to experience during those times.
Yeah.
Would you have anything to add to that, having gone through those things?
I do. Communication, you said it, but not being afraid to communicate and not thinking that something must be wrong because you're still dealing with fatigue, because things are still lasting. One of the big questions in our group, how long does it take to get back to normal? Why am I still tired? And it was your brain. And I remember my neurosurgeon said 365 days, give yourself that because, and then, in group, everybody looks, oh my God. But you know what? It's better to take that time. But again, communicate, because trying to be a superhero you can be a superhero in your journey, but still take those steps, because pushing it and making it worse is not going to help. But again, communication.
Mm-hmm. I always tell people that the brain is a finicky little organ and it doesn't do anything quickly. And seeing sometimes that progress as you're moving through treatments and recovery and things like that, I always tell them too, is that you're not going to see the difference always from day to day, is that sometimes you have to go, how did I feel a week ago? How did I feel 2 weeks ago? And that's where you're really going to see those bigger jumps in progress and things like that. So you got to cut yourself a little slack and know that you're not just going to jump out of this and just be back to normal.
Exactly. Yeah. And journaling comes in handy with that, because it's written sometimes, and the memory, sometimes you don't remember, you go, oh my God, 2 months ago, oh wow, I have made some progress. So that's another good tool.
Great addition.
Yeah. The question I have is, what are the best resources for getting information on the disease and treatment options, etc., for good info? And we kind of touched on it, but reputable resources, I think, would be those like the national groups and ABTA, MBTS. But again, some of the people are like, but how do you know about that if you've never had a brain tumor before? If you pop onto Google, and we always tell people, please stay off of Dr. Google. I think now we've come far enough, and especially with the Ivy Brain Tumor Center, you have those resources. Ask your doctor. I know on the website they reference that kind of stuff under the resources, and then go from that, because you can get on there and being taken on, on a whole different path, which is not going to be positive for you. And your friends mean well, but it can really take you on a path of destruction, because then you get so depressed. And That happened to me. You know, you want to listen to everybody and you finally just have to set up your boundary. It's not bad, but you have to say, okay, I got to take a step back. But again, most of your treatment centers, even if you're not treated here in Arizona, have that good list. And you'll know when you get on there and, you know, start reading this stuff.
I always tell people major brain tumor centers. There's a lot of them around the country. So you want facilities that have high volumes of brain tumor patients. They're going to be your knowledgeable, good resources to kind of guide you where you are or where you need to be. One thing that I also tell people is clinicaltrials.gov.
Wait, I forgot to mention clinical trials because that's an awesome resource.
Yeah, so if you're looking for different clinical trials, clinicaltrials.gov is a website that has every clinical trial listed in the entire world. So it can be a little overwhelming, but if you narrow down by diagnosis and region, you can kind of narrow it down. In every clinical trial that's listed, there is a contact person. So that way you have somebody who you can reach out to and touch base, say, hey, here's our story. Is this something that would be appropriate for us or available to us? The other thing that I say is as you're doing research and you're getting out there and finding out about different treatments, 100% if it sounds too good to be true, it probably is. So be leery of anything that costs large amounts of money or, you know, like I said, just if it sounds too good, do your research on whatever that product or whatever that treatment is.
And on that note, people don't want to tell their doctors if they're going to do some kind of side treatment. Still tell your doctors, you know, because something you're doing could affect some of the treatments you're doing. And a lot of times doctors will tell you, hey, I'm not, you know, maybe I don't agree with it, but, you know, this might hurt. Because we talk about that in group. You know, this might not be what the direction I would take, but, you know, and this particular thing you're doing could affect. And we always say in group, I'm not a doctor, I'm not a nurse. That's why we love having you in the group, Jackie, so you can say, you know, definitely talk to your doctor. But yeah, I think that is important because we hear some people, you know, trying to give advice and it's so important to tell your doctor what you're doing.
No, I agree 100%. You should always be able to have an open, honest conversation with your doctor, no matter what their opinion is of it. You know, just make sure you're having those conversations. Good point. My question next is going to be, what do you tell caregivers who struggle with guilt when doing things for themselves?
You want to answer that?
I would love to answer this. So the big thing that I tell caregivers is you have to put on your oxygen mask first before you can help the person seated next to you. So in order to take care of somebody else, you have to make sure that you are in a good place. So if you're not taking care of your needs, making sure that mentally you have some downtime, you're getting some respite, you're eating well, you're drinking well, you're doing the things that you need to do to put yourself in a good place. You need to be able to do those things in order to care for somebody else. So taking care of yourself is 100% what makes you a good caregiver and will make the whole situation more manageable and better in the long run, if that makes sense.
It does make sense. Many people might not know this, but I was a caregiver to a brain tumor patient before I was a patient. My grandmother was diagnosed with glioblastoma 6 years before I was ever diagnosed with brain cancer. So I knew none of this stuff before. And again, that was part of my passion. So exactly what you're saying. My family was exhausted and I didn't know any of this stuff. I didn't know to say, hey, slow down, you know, it's better to not eat all the cookies thinking, you know, she's not going to be around than to let's eat healthy so we're not tired and worn out. Yeah. So absolutely 100%.
Yeah. Before we go on to your question, I'm just going to remind people again for the new people coming in is that we are taking questions live. So feel free to submit them through Instagram or, you know, on here and we'll try and answer them as we go. So okay. Go ahead, Lynette.
How to deal with the possibility of a reoccurrence. This is a good one. I'm 22 years out and I've had 5 surgeries, so I've dealt with this. My personal response to this through the years is, and I learned this from a friend of mine who's has a brainstem tumor. Don't chase the disease, stay ahead of it. Always have a plan of action. We've dealt with being terrified of getting this horrible diagnosis the first time. So it's kind of like we've had a chance to prepare. You're not predicting that it's coming back, but you're just prepared. Okay, if I'm going to be slapped with this again, I might as well have. So for me, I'm like, okay, my neurosurgeon retired. Who would I have do surgery if? Because that's kind of scary. You trusted this first person, and even doing what I do, I still go, who would I have do it? Because there's so many great people around me. Which one would I choose? And what's out there? So I'm constantly like saying, okay, this is new. If it came back, what would be appropriate for me? Now, is that absolutely what I'd follow? Who knows? But at least you have a plan so you're not taken off guard so much.
Yeah. No, and I agree 100%. Always kind of know what your next step is. But one thing that I also tell people too is don't live your life based on waiting for that to happen, because that's not what we're here for. We're here to live life, enjoy time with our families, and do the things that we want to do and experience things. So we want to make sure that that's our focus. But just have that plan in your back pocket for sure.
If I can add to that, don't let the C word, and you don't have to have the cancer. It can just be a meningioma. It can just be, benign. Don't let the tumor define you. So absolutely don't live. Sometimes we're given a date. Well, I've had patients go, okay, it's a year. I was told I was going to live a year. Don't live to that. Just live. And if it comes back or something, because if you're counting down, then you're not living. So absolutely live life. And it's easier said than done. I get it. But truly, if you can get to that point, then life's going to be much better.
Definitely. I always tell people nobody's put an expiration date on anybody's foot. So, you live your life and go from there. Statistics are just that. They're just numbers. So we did have a question come in, how to deal with a caretaker. Sounds like it's a son that gets overwhelmed. So I'm going to assume that this is coming from the patient and they feel like their son is overwhelmed with being a caretaker. And so, and I think this is a great opportunity, because I think sometimes caregivers are afraid to tell patients what they're feeling, and patients sometimes are afraid to tell caregivers what they're feeling. So sometimes there's this silent suffering that kind of goes on, but really having those open conversations about what you're feeling and what you're going through and things like that can help, because you can have this open conversation of going, I feel like you're a little stressed. You need to take a little time for yourself. And finding, if you can't be left alone, is there somebody who can come in and be with you so that your son can go out and have a little fun and kind of de-stress a little bit? Or, finding some ways to do whatever it is that refills his tank, if you will, to kind of give him that break.
That is exactly why we have a caregiver and a patient group. So you can discuss those issues, what other caregivers are doing. And in the patient side, we discuss how maybe the caregivers are so overbearing, and not because they want to, I joke, well, yeah, they're going to boss us around because we want to do our own laundry, but because they really are trying to look after us. This is new to them too. And before you were diagnosed, they didn't have to, hover over you, but now they're scared. So open communication is exactly right. And the I and you kind of conversations. And sometimes that takes a different individual to, counseling, but whatever is good for but communication again, because being overwhelmed can cause some other issues to this situation. And that's not what you want. You need to be a team. And I say that because personally in our home, husband wants to be a fixer, and I still wanted to do my things, but it wasn't until we talked about it. It was like, wait a second, I got to be able to do my thing. And his was, I just don't want you to get hurt, and it's like, oh, I get it. Well, let's meet in the middle and make rules. So, or agree to disagree or agree. So maybe that'll help.
Yeah. And this is, a great opportunity that, depending on whether or not this is a person who would be open to a support group, just to meet other people and how they deal with caregiving and things like that, which just actually kind of segues into my next question of tips on how to take a break when caregiving. Because a lot of times people don't allow themselves permission to take that break and step away because they feel like they need to be there for their loved one at all times, if you will. So, definitely we talked about that. So utilizing friends, family, sometimes there's respite services that you can kind of bring in to kind of give that caregiver a break if it is a situation where somebody needs to have somebody with them all the time. using different services to take tasks off of their plate. So if they're cooking and cleaning all the time and things like that, kind of giving them a break from those things help. And like we talked about previously, of using your friends and family for those tasks around the house of laundry and shopping and things like that, taking out the garbage and whatnot. So that's what I would say in those circumstances. I hope that's helpful.
Yeah. I got one about discussing palliative care. When, you know, the confusion of it being hospice care, palliative care, and possibly explaining the difference. So I don't know if we kind of want to tag team on that.
No, definitely, because palliative care, you know, I think we talked a little bit about symptoms and stuff earlier. Palliative care is a great service. They do get confused a lot with end-of-life services, and that is not what they are about. So anytime somebody gets diagnosed with a significant diagnosis, then it doesn't even necessarily have to be a cancer diagnosis. But anytime they're struggling with symptoms or well, yeah, basically symptoms. This is a service that can be beneficial because their goal is to help manage those symptoms and improve quality of life. So, you know, if this is something that you're struggling with and you're not sure what to, who to turn to or who to talk to about these symptoms, and your doctor, you know, has helped you to a certain point, palliative care is something that can be more of a long-term provider that can come in and they can help with those things, help to manage those symptoms, if you will. Does that make sense?
Yeah, it does. Because of gray matters, I hear from the spouse, and it can be male or female. They're really struggling, and what I tell them, palliative care, well, my loved one thinks that means I'm telling them they're going to die. And I said, oh, absolutely not. I said, but what's going to happen is, you know, you're going to get hurt by trying to lift them or trying to move them. Palliative care will set up for pain management, will make suggestions, you know, where they're, you know, they were confused about it being hospice in group, saying, well, my wife or husband wants to bring this in, I'm having pain, they think I'm dying. And so describing that, and you've had that discussion in some of the symposiums that you've had. So yeah. So hopefully that question.
Yeah, we want people to understand the difference and know that this is an option out there, that if they feel like it would be beneficial, they can always ask their doctor for a referral. And even if it's sit down and talk with a palliative care provider and say, this is what we have going on, is this something that you can help us with? If, you know, if the person's doing well, you know, and they don't feel like they need assistance at that point in time, that's okay. You can always bring them in later down the road. Palliative care is something that people can have for years, you know, they can have that service and that support for years, but it will also help support the patient along with the family member too. So, so they can be very beneficial.
We got another question.
Oh, okay.
A brain tumor patient is asking if she should let her son, or if she should let her son go out with his friends. She's worried about COVID.
And he's a patient, I'm assuming? Or he's...
Yeah, I don't know if she's the patient. She's the patient, and she's wondering if letting her son go out is going to hurt her.
Okay.
Exposing her to COVID.
I gotcha. I mean, this is kind of a challenging time right now. So, you know, I mean, anytime anybody goes out, there's risks, you know, so we have to make sure that we're doing the things that the CDC is recommending to try and keep us safe, you know. So I think the question would be, you know, does your son understand, you know, the measures to take to make sure that he stays safe and doesn't contract anything to bring anything home? If you are in a vulnerable state, if you're going through treatment and have a suppressed immune system or anything like that, then it would probably be better to not have those additional exposures. But, you know, everybody lives their life a little bit differently. So I think those are just going to have to be conversations between you and your son of, you know, the risk levels and things like that and how to handle those situations safely.
Right. Everybody's family is handling it a little bit different is what we talked about. So your question or my question?
Tag, I'm it. Okay. So I'm going to go, well, so this one's kind of a all-encompassing. So, you know, it kind of covers common themes. So common themes that come up in support groups. So there's a few things that are just kind of listed here that I'm just going to touch base on. So common thing that I hear is my friends and family don't understand. So they don't always understand what the person's going through. People struggle with loss of independence, grief, because as you start to go through this, a lot of times kind of accepting that new normal, there's a process of grieving the person who you were, the family that you used to be, the relationship that you used to have. It can be a factor here. And well, we've kind of covered a lot. I think caregivers not caring for themselves. So how would you say in relationship, like friend relationships and family not necessarily understanding what a person is going through after a diagnosis? How would you help overcome that?
That's a big one because that comes up all the time. Again, we talked about this a little bit earlier. You look normal, you look okay, and constantly feeling like you have to explain yourself. Imagine 22 years and, I'm still struggling with short-term memory issues. So just coming right out of it and your head's not shaved and they're like, well, you look great. Why can't you do this? So we talk about in your circle of close family and friends, you have to tell them, I know maybe I look okay, or keeping that circle to the people that understand you, or setting up your boundaries just like you would in any other situation. But the new normal, sometimes you can't go back to doing what you used to. I can only relate personally and then what I have heard other people, because some people, a lot of the men say, I was defined by my job. I'm the breadwinner of the family. What do you mean I can't go back? But, we always say, never lose hope. I'm not saying that you eventually can't go back, but maybe take a step back so you can look to getting back to normal. My personal suggestion is always put stuff on the calendar and shoot for that. Don't give up. Don't throw in the towel, but have a plan. And again, surround yourself with people that are going to understand your short-term goals, and understand that it really sucks, but there's going to be those that are going to fall off. And it's really hurtful, but it happens, and it's really hard. We have people break down in our group because family that they love and are close to them that just don't understand. And sometimes we can get them to come to group, and sometimes it's just a loss, and it's really hard. And sometimes it's people that you really love. So it's hard, and there's no set answer, Jackie. I don't know that you're in it every day. I hear it from people I don't know that are just calling. So it's hard.
I hear a lot of struggle with fatigue, and the caregivers don't always understand, because again, they look fine, but fatigue is a big symptom after a brain tumor diagnosis, and it can hang on for months. And, a lot of times people don't understand, why that person isn't getting up and doing more, or why when they want to go out to a function, they're not feeling like it and things like that. So one thing that I would caution caregivers is, try to understand that element. And, one thing that I would tell survivors is try to communicate that. And whatever it is that you're feeling or whatever you're struggling with, try to make sure that you're communicating that to your caregiver so that they can have a better understanding, because they don't know what you're going through. And on both sides, nobody knows what you're going through unless you verbalize it and can communicate it.
On that note, just as soon as you said that, is we don't like feeling that way. It really sucks being tired. It sucks when your kids or your family, I told you that. God, I've told you that 5 times. Just as the caregiver, just those out there that we're speaking to, trust me, we hate having to tell you it. So if we're annoying you, just think about how annoyed we are having to tell you again, and we didn't, or we don't remember that memory. So just as much as you're being annoyed, we're frustrated that we've had to tell you that 5 times. And if you're feeling bad that that's happening to you and you just started this journey, 22 years. It's not as bad as it was, but I'll still have family members, I quit trying to hide it. I like my dad. Well, I told you that. So I have my big calendar. I write everything down, and now I'm still, Dad, I'm sorry. I didn't write it down. My bad. Text me. So I have little tools that I use, but it's tough. But you create new things, and you got to create whatever works for you. Some people, it's technology. For me, it's pen and paper.
Mhm. And what I would say also too is that, just if you find that this is creating like tension between, you and your loved one, counseling is not a bad thing in these circumstances. One, because it can help work out a lot of the feelings that you might not know how to process going through this, but it can help with the communication between you and your loved one through this. All right, I think it's a question to you, my dear.
Okay. Adjusting to the new physical appearance if you've had physical deficits. I actually have someone in our group that had physical deficits, so I can answer this one, and you know this person, so you might be able to add in. We had a person in our group who, after his surgery, had some facial deficits, and I actually asked him, kind of teary because he was emotional about it. I said, what do I share with this person that wrote this question? And he said, I used to be angry. I went the why me, why God? And he said he had this experience. He said, I was at church one day, and he said this little kid kept turning around, and he says, I wanted to smack her. He said it was just so frustrating. He said, and some people might not understand this. He goes, and I used to work in a school, and kids, he said, I had to make it a game. He said he told these kids when they'd say, why is your face like that or whatever? He says, I finally came up with because I didn't eat my vegetables. So he says, and he said, so one day he heard the little girl say, when somebody asked him, he goes, don't ask that. He didn't eat his vegetables, and he said it finally kicked in, but that's how he dealt with it funny. But he said this experience at church was when this girl, she had some mental challenges, and she went up front for prayer or something, and she came up and she grabbed his hand, and it was very obvious that she had some deficits. And he said at that moment he felt like, if she can make it through life and everybody's looking at her, what am I doing? I have a story to tell. And he got emotional, I got emotional, and I'm like, you know what? It's true. And this person has a heart of gold. And, he encouraged people, don't let that stop you. There will be a new way. And he says, I know it doesn't seem like it. And he said he just wanted to run and hide, but he said if he can encourage anybody, that it will get better. So, emotional one.
So I had a question that came through from Maria. It says, I lost my emotional memory after my craniotomy. Did it happen to anyone else? And I'm going to tell you 100% it has happened to other people. I don't know if there's anybody else that's on this right now who has gone through that experience, but depending, again, location of tumors, sometimes it can affect that ability to process emotions, and sometimes they come out inappropriately or not at all, and people can have what we call a flat affect, where you just don't respond and you're just very straight-faced and things like that. So what I can tell you is that this is something that people go through, and I would encourage people that the more you connect through different ways, whether it's a support group, community events, on the Ivy pages or whatever the case may be, the more you talk to people, the more you're going to find that lots of other people have gone through the similar things that you're experiencing, and it's a great way to connect and process and work through those struggles. So, we are kind of getting to the end of this session. So what I would say is I would encourage people to continue to be involved, continue to tune into our events, and hopefully we can help you guys make connections. Our support group is online and it's open to everybody, so I would definitely encourage people to get involved if that's something that's beneficial for you. So I'm just going to say that I think this is it for our first brain tumor talk. Thank you, Lynette, for joining me and all of your wisdom that you have imparted us with. I appreciate it very much. Just so you guys know, for our brain tumor support group, we do this on the second Tuesday and the fourth Tuesday of the month. We have an afternoon session for the second Tuesday and an evening session on the fourth Tuesday. Everyone is welcome, like I said, so you don't have to be an IV patient or a Barrow patient in order to attend. Registration is online, and you have to pre-register just because we don't want the group to be too full, because we want people to have a chance to talk. So you can find the details for that at our link in our bio. We will be sharing this video on our feed, so if you have additional questions that we didn't get a chance to answer during this, please, we'll try to get them answered as soon as we can. Okay, and we appreciate you guys participating in this and sending those questions to us. And I think, also one other thing that I would say is that if you are out there looking for different clinical trials or different options, please visit the Ivy Brain Tumor webpage, and there's a navigator that can answer any questions or assist you with anything that you might be looking for or have questions about. Lynette, do you have anything else to add, or do you want to tell people how to find you?
Yeah, just to add on that last person you commented about, as a tip, is possibly just be honest with people. When I go to conferences, I tell the speaker, I introduce myself and say I may have to get up because it's information overload, and maybe tell your friends, tell new people you meet. It is nothing personal. You don't have to go into your long story. So, and that has helped me through the years, and they really appreciate that. How to find me, here on Instagram, graymatters.org, same with Twitter, but make it easy. On the Ivy Brain Tumors website, I'm listed under resources, and my website's on there. And I'm the person who checks the email, so if you write me, I will write you back. And I think that's it.
All right. Well, thank you so much, and thank you again, everybody. You guys have a great day. All right.